What will I gain from this video? After watching this video, you will know how to distinguish between the whiteout caused by the collapse of a lung and the whiteout caused by a pleural effusion. When we have a centrally growing mass, as the mass continues to grow, it will obstruct the bronchi and can lead to collapse of a lobe or to complete collapse of the left lung. When complete collapse occurs and there's full absorption of the air from the collapsed lung, we call this whiteout. With complete collapse of the left lung or the right lung, we would expect the volume loss to cause deviation of the trachea and shift of the mediastinal structures to the affected side. In this case, we have an obstructing central lesion that has caused collapse of the right lung. We see that there is mediastinal shift partially to the right related to the collapse. In this case, we see complete whiteout of the left hemithorax by a large mass and significant displacement of the mediastinal structures and the trachea to the right. In this case, the CT scan shows that the abnormality on the left is in fact caused by a collapsed lung, but also by a large loculated pleural fluid collection that not only contributed to the collapse of the lung, but also is a major contributing factor to the mediastinal and tracheal shift. In this case, we see collapse of the right lung, but also adjacent to the right lung, we can see an opacity within the right hemithorax, which is consistent with a right pneumothorax and a right pleural effusion. In this case, we see complete opacification of the left hemithorax, but we can identify clear air bronchograms telling us that there is an alveolar or airspace process occurring within the left lung. This patient may also have a pleural effusion. However, without further cross-sectional or ultrasound imaging, this is difficult to definitely determine. In this case, we had a large central mass causing collapse of the right lung. The patient went on to post-obstructive pneumonitis and pneumonia, and eventually to an empyema. When the patient presented to the emergency department, there was a small air fluid level within the upper aspect of the right hemithorax, consistent with an empyema. Whiteout of a hemithorax can also occur post-operatively. In this case here, the patient's had a pneumonectomy. Post-pneumonectomy, there was some hemorrhage into the right hemithorax, which then went on to scarring and fibrosis, and the patient now has a thick pannus of fibrous tissue within the right hemithorax, giving the whiteout appearance. So in summary, when you see a whiteout on an X-ray, always check the position of the mediastinum. If there's a pleural effusion, you would expect the shift of the mediastinum away from the effusion. If there's collapse, the shift of the mediastinum should be to the side of the collapse. Frequently, a whiteout of a hemithorax is caused by a combination of collapse and effusion.